Hello, welcome back to my YouTube channel. Today is Q&A day, so we have had Q&A with the children, and right now we are going to have Q&A with the hubby. So this is my husband, Noel, and he has been my amazing support since we've been married. We've known each other quite a while. It's been a long time. Yeah, we've known each other since high school. So at any rate, some of the things that I'm going to ask, this is totally ad-libbed. So I thought it would be fun to know a few things, but also this is going to be for prosperity's sake. So something that the kids can look back on, something that I can look back on in a few years, especially as we go through this journey of the amputation and what it meant to our family. And who knows, maybe as we look back on it, we'll go, oh my gosh, we can't believe we thought those things. Or like, why did we not do this sooner? Or I don't know, whatever, any number of things.
Why did we even do that?
Yeah, maybe that, maybe I'll just like be walking around, like I'll hop a lot. I'll learn how to hop, right? Yeah. Hop along, Jen. Yeah. At any rate, so we've heard from the kids. So the first question I have for you is, what do you think about the idea of the amputation in general? Like, what do you think this is going to be good or bad or impactful, not just to me, but how do you think it's going to affect you?
Well, it's going to affect me knowing that you will not be in pain any longer. Or,
minimal pain.
I was going to say, exactly.
Yeah. We're still expecting pain.
Yeah, she'll still be in pain because of her other medical ailments that's going on with her. But the ankle won't be the driving force behind why you have to have a pain management doctor. Why you have to have ongoing pain medications.
True. I mean, because we have a goal of me reducing or actually coming off of the pain medications altogether. Please, 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 please. I don't even drink. Actually, I don't like being impaired in any way. So I like being sharp-witted, especially like if I'm gonna perform shenanigans on other people. So
what, you?
I know. So how do you think this is going to impact you?
Well, to finish it, since her RA and fibromyalgia causes pain, she'll still have pain medication for breakthrough pain, which Dr. LeMayo already said, there's no reason why you shouldn't have medication for that breakthrough pain that you have with your RA. So that being said, instead of having the level of narcotics she's on now, it'll be down here.
But I'm also typically on a level 9 pain with the ankle. So the RA and the fibro, there are days where I don't have any pain and I'm totally fine and I can manage, and those are awesome days. And the only thing then that's limiting is the ankle. And it used to be that with the management of the RA and the fibro, I could still do all the activities that I used to and then just have some days where I kind of paid for it. But now it's all kind of tied up together, and it gets really bad where now my body just seems to be in a constant state of shock recovery. And so we're hoping that this will actually decrease that significantly. But you personally, what do you think?
It kills me that, that she's in pain and there's nothing I can do for it. It doesn't matter, if I was a brain surgeon, there's nothing I can do about the pain she's in. So with the problem child gone,
Quasimodo,
that reduces the amount of pain or days that she's going to be in exacerbating pain. So that will be lighter on my heart, because it sucks when I have to go to work. I'm gone all night and I get those texts from her, just the crying emoji, and I know what it means. That she's at a level 9 or 10 pain and she's borderline calling up. I gotta go to the ER. I mean, I'm not gonna begrudge her that, because there's no way I could possibly know the amount of pain she's in. I mean, we've all had things that have happened to us that were in pain, but considering what I do, and I talk to my patients and women.
He's a nurse, by the way.
nurse and a
Many
paramedic.
of you don't know
I
that
guess.
he's a nurse and a paramedic. Probably should have said that.
Yeah, most people don't even know that. But I ask patient, when I evaluate patients, it's are you having pain right now? And if you are, from a 0 to 10 scale, what would you call it? And most of the, not to be mean, but most of the male patients, I have to specify, okay, they're about to say, I can see the word 10 coming out of their mouth. I said, 10 is I have ripped your leg off and I'm beating you over the head with it. Oh, it's a 5. Okay, thank you.
Mm-hmm.
Women that have given birth have the most realistic pain scale rating.
Mm-hmm.
I don't know what it's a whole childbirth thing. They all know what a level 10 pain is.
Yes, but we're also more equipped to handle pain. I mean, that's physiologically
absolutely
a known fact. And it's not to begrudge men their level of pain or to invalidate their pain. It's just that, physically we're different. And so I think that changes those pain scales. But you and I have had those discussions why pain scales don't really work, and they're not accurate, and they really don't take into account people who are chronic pain sufferers.
Mm-hmm.
And unfortunately, the medical community, we have people who really do care, but we have either politicians or just our medical system in general that doesn't take into account what chronic pain sufferers actually have to go through. And, that's a topic for another time. So what are you most excited about as we look forward to the future? So say after I'm already healed, what are you most excited about?
Most excited about you being able to, her biggest thing is that I could take the dogs for a walk. She can't go. Literally, she'd get to the end of the street and I'd have to piggyback her back to the house because there's no walking the dogs. She could go for a walk with the dogs.
We can hike again.
Yeah, we can go hike in the woods with the kids.
Oh my gosh, camping again?
Exactly.
Woo, I'm so excited.
I mean, there are a lot of things that she is limited on that I know kills her that she can't do with us. I take the kids to the pool in the summertime. And I do videos of the two of them simultaneously jumping off the diving board. Look, what?
He makes the videos because I'm not there.
Right. And because to walk through the parking lot, walk across the pool deck, and then try to ease herself into the pool. Once she's in the pool, she's good because, less gravity. But getting her out of the pool and then getting her back in the vehicle and then driving home, she'll be done. And knowing that she can now go to the pool with the kids.
We just get to have our life back,
right?
I think.
Well, more than just our life, your life. Because your life has been stepping back from family activities because you don't want the family to not do things because of you.
Let's just say there's a whole lot of vacation activity and adventure photos without me. So
yeah, me and the kids' yearly trip to Cleveland to go visit family
I'm not there.
and friends. Well, A, you're not there because you're doing your event, but B, even if you were there, going to there's a beach along the lake shore, Huntington Beach. To get down to it is a staircase that goes like 60 degrees.
Yeah, forget that.
And it's it takes like 5 minutes to get down the stairs. Yeah, she can't do that.
We will be able to go shark tooth hunting once I'm healed.
Yes, over to Shinkati.
Yes. Well, it was the one park where we wanted to go fossil hunting, and it is well known. It's up in Maryland, and it's well known for its megalodon teeth. And as a family, we had wanted to go, and we did try. We gave it an all-out, just good-natured try.
Piggyback ride.
Yeah, I wound up having to be piggybacked, which I hated. And then Fallon picked up the scooter and was carrying the scooter. It was a nightmare. So what is your biggest concern, either pre-surgery or post-surgery? Or both?
So with that, it's always the complication, the thought of complication that would take her from me. So.
And we did have a conversation last night, because it's very important to do that, where we talked about what our wishes were, and we were open with each other about what, in the event that the worst happens, like what is that, and what would that look like, and what do we want to have happen. Now, both of us like to have a lot of humor, so I want to be a tree. I think it would be kind of, yeah. So, we've talked about, like, if the worst happens, but what about afterwards? Like, what do you, what are some of the current concerns you might have for even after surgery?
That there'll be complications that would cause setback. So this will be number 13.
Ooh, we're not superstitious though, so that's not.
It's a number. So there are, I have to say 75% of the procedures she's had thus far, there's been some sort of complication causing a setback to healing and her on the progression to, it's hard to say, normalcy that they predicted.
Yeah, but I've never been normal.
Right. Well, you're not normal.
Well,
anyways,
and then
so.
this last surgery, so normally the surgeries at least I will heal from, but this one it didn't. Like, so I think it's currently at 40% healed. So we had the surgery I had the surgery in July of 2020, and now it is April of 2021, and 40% of the bone is healed, and that's the body basically just rejecting. So that's why I truly believe that the amputation is important and necessary, because the tibia itself is now damaged, lower than mid calf. So mid calf is about where that plate was placed, and it's from there where you see a significant degeneration in the size and shape of the bone and the calf muscle. So yeah, there's always the potential that it's just not going to heal right, and that maybe I will wind up in a wheelchair permanently, but I'm just not considering that as potential at all. I'm going to stay optimistic, even if it's a wild card. I will choose to be optimistic. So the kids have talked about how this is affecting them and some of their concerns. Their biggest concern is what it's going to look like, and them being initially afraid of seeing it for the first time. How would you address that, or how do you feel about it? Have you ever seen an amputation before?
Is this a trick question?
Well, I don't know. I don't know in your medical career if you have.
Yes.
Well, I mean, you've seen it happen. All right, so as a paramedic,
amputation.
yes. So you've seen it not healed. You've seen it
I've seen it fresh.
Yeah, the bad stuff.
Mm-hmm.
He was a flight medic too, so he would always have to go to the worst accidents. But all right, so in the healing process, so you're going to see it healed, and the kids have talked about the fear of seeing it for the first time. So how would you address that with the kids and help them through that? But also, how would you address it, or how do you think you're going to feel about it? Is it going to be shocking, crazy, or it'll be
shocking, crazy for me? I'll be like, it's gone! Yay! And I think you should get the little zipper tattoo.
A zipper tattoo?
Along the tattoo?
You can't.
Along the scar?
You can't. Yeah, you can't do any of that. Because I have thought about doing a tattoo on the leg, but we can't.
Yeah, I know. It'll mess with the healing.
Yeah, so... Well, also, you can't have any kind of skin degeneration or potential for infection or anything like that. But I could always do a really cool tattoo on the other leg. So... But the kids, I mean, do you think they seem like they're going to be totally fine? But
I think once we get over the initial shock and awe, and see you not in long-term pain, because they're going to see you in pain like they have some of the other surgeries, and they're going to at first ask, why are you still in pain? The foot's gone. Well, she had a surgery. The body has been traumatized.
Yeah.
So we'll have to address the initial traumatization, and when mommy heals, everything has to heal. After every surgery, the body has to go through healing. So once mommy goes through the healing, you'll see mommy not crying in pain all the time. Mommy's not going with us today because mommy's hurting. Mommy can't go to the bookstore.
Well, you do know there's going to be days still where I won't be able to wear the prosthetic. There's going to be swelling. There will be days where I instead will have to use my scooter. We're prepared for all of that. And honestly, that's not going to be that big of a deal because I'm so used to it already. So here's another question. What do you think, or do you think there is going to be any limits or changes to our intimacy? You're blushing a little there, honey.
Well, the evil thoughts running through my head because I'm going.
Remember, this is for public.
I know. That's why I'm just like, I'm gonna no.
Yes.
I
amputation.
See them going.
Yeah. So no, amputation does not affect that. But if anything, taking away the pain might make things a whole lot better.
Absolutely.
Yes, because there's a lot of times where I'm just like, I'm sorry, I just hurt. And pain is exhausting. It really does. It takes away so much energy. And when you're just so tired, it's hard to, want to be intimate. And it's hard not to want to be intimate when, you have a totally smoking husband. So there's that. I was telling the kids that it is going to be really cool because we will be able to do adventures again. And that they will need to keep up with mommy this time instead of the other way around.
Well, because there's a day where we could spend completely out west, out there in the Culpeper area, and the final stop in the day is our favorite ice cream shack.
That's true.
Because normally it's a drive-through and stop in and grab a quick bite ice cream from the Moo-Through.
The Moo-Through. Oh my gosh. If you are ever
Moo-Through.
Oh yes, if you are ever in Virginia, you have to go to Culpeper and you have to experience the Moo-Through because it's the best ice cream literally I have ever had in the United States, in Iraq, in Kuwait, in China. What other countries have I been to? Mexico. Central America. By far.
She's been to a strange
Europe, Scottish,
country called Texas.
But seriously, the best ice cream I've ever had in the world, or any of the places I've traveled. But it's fresh. They're a dairy farm, as we give so much kudos and plugs to the Moo-Through. But when you said out west, I immediately thought Yellowstone.
We could eventually get there.
Yes.
Once, two people finish school and...
Yeah, true, there is that. But I think that
now
having a prosthetic, I think it's going to be exciting because we can finally go to those places that I have not been able to go to in the past decade because of these injuries. So that's kind of exciting. I'm excited about that. I want to take the kids out there so badly, and I want them to see a buffalo. Yes, I want them to experience that. And the springs and just all the cool things that Yellowstone has to offer, and also the beauty of nature and all that. But camping, oh my gosh, yes, it'll be awesome. So as I continue these YouTube videos, there's probably going to be some additional questions and stuff that people have that might be good for us to try and answer together as a couple. But I think that this one in particular is important because it's doing the prep work. So for example, we have next week, I think, is when we'll get to meet Joey Pleven and his wife.
I thought it was this week.
Well, this upcoming week. I know they're coming in on the 17th.
Okay, so it will be next week.
Yep. So we'll be able to talk to them and just get some more information. And we have some homework to do in terms of making phone calls and finding out about these other medical procedures.
On top of our normal homework.
Yes, the litany of things that we do on a daily basis. I have a million more orders I still have to try and finish, and then other phone calls to make. But what are some of the things that are like really pressing to you that you've been thinking about with this entire process that you would like to just put out there and document as part of your journey? Because I'm not doing this alone. This is me and you together. So like what, it's your journey as well. So what would you like to put out there to either the YouTube community or for, our family as they watch this maybe later on, as we look back, with happiness on our faces and think, why did we not do this sooner?
This was not a decision made lightly.
Mm-hmm.
This was a decision years in the making. So if people ever go, I can't believe you just made that decision on a whim. No, there was no decision on a whim. This was, oops, sorry, I didn't mean to get the camera. This was not a decision made on a whim. This was lots and lots of pros, cons, back and forth research. Thank you, Footless Joe, for lots and lots of input you've given to questions that she's had, I've had.
Mm-hmm.
So, I mean, there's nothing about this decision that was on a whim, was willy-nilly. It was well thought out, and as she said, took too long. I mean, promises from different surgeons. Oh, we can fix that. Oh, we can make you feel better. Oh, we'll get you 60% better. Not even there.
Yeah, or even promises that I would be able to do all the physical activities that I used to do with a fused foot that was not honest. That was not honest from our doctor.
Don't mention any names.
Yes, the bottom line is that with a fused foot, with a fused ankle, I was able to do and will never be able to do any of the activities that I used to do.
Nope.
Even walking backwards is incredibly challenging, and I cannot walk on any surface that is not 100% flat. So like camping is pretty much out right now, and part of my business requires that I participate at events that are outdoors. So my final question to you, at least for this video, what was, in your opinion, that moment in your head where it was like, okay, that's it, we're doing this? Like, what was the final straw per se? Was there something that made it so that you were like, really, like, instead of just kind of ephemerally going after it or lightly going after it, where you were just instead like, this is happening, like, come hell or high water, the leg is coming off?
It's not one moment, it's a couple things all together, and they kind of sort of all coincided on the same day. She was in a level 10 pain, unable to walk. My heart cracks every time. So she's in pain. I'm trying to help her, trying to get her ready, trying to get food squared away, and knowing that I gotta go to work that night, to leave her to be helped by our 9 and 10-year-old who have been awesome through all
They
this.
really have. Yeah.
Mommy needs your help today. Okay. And they're Johnny on the spot and make sure mommy has this, make sure mommy has that. They get themselves upstairs and they get themselves in bed and get ready.
I can't tuck my kids in at night.
That too. So all this is going on, and then there's a bill from the last surgeon who said, yeah, you'll be able to walk. So, bill from last surgeon, her still in pain after a year and not being able to walk. Oh wait, I take that back. She can walk to the bathroom, but might not be able to walk back without being in pain. Thankfully, she's emptied her bladder by then, because she might have stress incontinence, and
that happens a lot, unfortunately. Like, the pain will hit and I'll either vomit or urinate, and that is so embarrassing. It's horrible. It's just horrible.
So, like I said, it was more than one thing. It was just all kind of all rolled into one. Hell happened at once one day, and boom. I'm like,
so it was more like a pressure point for you. It was just the culmination of everything that happened all together, and you're like, that's it.
yep.
Okay. Well, anything else that you would like to say for right now?
Nope.
Nope. I know he's not really that talkative, so this has been pretty pretty awesome, actually.
Talkative for this kind of stuff, yeah. But...
Yeah. Okay. Well, I think that's it for now. We have talked your ear off, but if you have any other questions, we would really love to hear it, and we will be more than happy to answer them. As we get more information and as we go through this process and journey, we will, of course, continue to document, especially not just for ourselves and for the kids, but also because there is a small chance that it might help anyone else out there. Just one person would make all of this so much more worth it for me. So I would love to hear it. If any of the information is helping in any way, shape, or form, let me know. That is just, it's just so amazing. And that's really why we chose actually to document this, is not just for the kids, but in the hope that maybe this would help one person.
It was more of a chronicling.
Mm-hmm. So this is the journal, yeah.
Chronicling and journaling about what you're going through and what's going on is therapeutic. Mm-hmm. And not only that, when we know it's coming, when she has that point post-surgery that she starts screaming and second-guessing herself, which is going to happen.
It does. That is, I've talked about this, and it is a typical surgical response. It happens to many people.
These up and go, look, this is why you did it. This is why. So it's not just for people to watch and see. It's also for her to look back on and go, true. You know, her own voice of reason.
Exactly.
So,
all right. Well, thank you for spending some time with us. We appreciate it. And
Beauty Pageant wave.
Have a beauty pageant wave. Or no, that's the queen wave, isn't it?
Same thing.
Sorry, you have to do the elbow thing too.
I don't know.
All right. Bye. Have a great day.